Hello, my name is Tiffany Hutchins. I'm an assistant professor at the University of Vermont. I am joined today with my co-presenter, Hope Morris, who is a master's certified speech-language pathologist, and you'll be hearing from her a little bit later on. We are going to be talking to you today about how to use social communication strategies to address behavior challenges in autism spectrum disorder. Get to the next slide. There we go. I wanted to let everybody know that there is a paper. This talk is based on a paper by Hutchins and Praylock, and if anybody would like a copy of that paper, this is going to be available through VFN. They're going to archive this webinar, and the paper is going to be part of what you will be able to access. And we are trying to figure out how to forward a slide. Okay. So the primary purpose of this talk is to describe the relationship between communication impairments and common challenging behaviors in individuals with autism spectrum disorder who may or may not have a concomitant intellectual disability. These communication challenges are described, and several evidence-based intervention strategies are proposed to support communication so as to decrease challenging behaviors. And we've tried to select a variety of approaches so that there's something here for everyone. We were thinking specifically about individual differences in age and language and cognitive skills. So whether a child has limited productive language or is functionally nonverbal, or whether they have precocious language and cognitive skills, there are evidence-based strategies to use communication to decrease problem behaviors, and we'll be discussing a few of those here today. So challenging behaviors are a frequent concern for individuals with autism spectrum disorder, and common challenging behaviors that occur across the lifespan include self-stimulation and stereotypy, self-injurious behaviors, noncompliance, physical aggression, and a host of other destructive or disruptive behaviors. And without appropriate intervention, this can be a problem because challenging behaviors tend to persist in individuals with autism. This can lead to exclusion from education and community-based services and social participation more generally, which in turn can serve to limit further opportunities for learning and development. So clearly, challenging behaviors have important implications for treatment planning and for the training of parents and professionals who provide services to individuals with autism. So self-stimulation and stereotypy. When we are talking about stereotypy, we're talking about stereotypic behaviors, often in the form of motoric, repetitive motions that are atypical. Okay. Now, crucially, individuals with autism and intellectual disability often use challenging behaviors as a form of expressive communication. And while problem behaviors are not desired, they are effective for getting one's needs met. And this is why individuals with autism and other developmental disabilities engage in them. I know a little boy who gets anxious when other people get too close to him physically, and his solution is to reach over and grab that person's face and to lick the person's face. And that seems quite strange to us, but it can make perfect sense to a child with autism, and it is a really effective way, when you think about it, for him to get what he wants. He gets what he wants immediately. He gets it every single time, and so this could seem like a good idea. I've heard Temple Grandin talk about this also, and it's always a laugh line in her presentations, and she will recount a story about how she would throw tantrums in high school before she would have to go to French class. And She knew and acknowledged the fact that other people must have thought she was mad, but she always says, you know, the joke is on them because I always got what I wanted, and it worked every single time I got out of French class. And so challenging behaviors occur because they're effective in some way for the individual. They also occur, and this is a crucial point, because they are a form of expressive communication. That is, they are communicative. They're just not desirable or socially adaptive. So this idea that challenging behaviors are a form of expressive communication is reinforced by the finding that individuals with autism with higher language skills have fewer and less severe behavioral challenges. We also know that interventions that focus on establishing effective communication show reductions in a variety of disruptive behaviors, and those are some of the interventions we're going to be focusing on today. So the purpose here is to describe the importance of engaging the individual with autism in a process of communication development for addressing challenging behaviors. It's necessary so that the individual may come to experience firsthand the power of communication as an effective tool for satisfying needs and expressing thoughts and feelings. You know, sometimes this is going to take the form of training the individual to communicate with words or with signs. Other times it takes the form of engaging the child in a process of communication with an adult. Here the adult talks to the child, and sometimes the adult talks with the child, but in either case the goal is to give the child information about what he needs to know to be successful. So we'll talk about each of these approaches. So to support effective communication and ultimately promote more adaptive behaviors, it is instructive to first review the communicative challenges characteristic of autism that are most relevant for our purposes. Now, one difficulty in describing communicative challenges in ASD involves the tremendous individual differences in cognitive and linguistic abilities. So, as I'm sure you are all aware, some individuals show severe cognitive impairment. They might have extremely limited comprehension or maybe functionally nonverbal. But other individuals on the spectrum can outperform neurotypical people on verbal and nonverbal tests of intelligence, and they have precocious vocabularies. So of course, we also see a large number of individuals with uneven profiles, so that there are strengths in some areas of functioning and challenges in others. However, even those with the most language and the most flexible language and the highest cognitive skills, they experience considerable difficulty understanding and using language to express themselves appropriately for the purposes of social communication. So pragmatic deficits, that is, deficits in the social use of language, are particularly emblematic of the disorder. So where do these pragmatic deficits come from? They are partly explained by deficits in language comprehension. Unlike neurotypical kiddos who can understand more than they can say, you tend to see the exact opposite pattern in many individuals with autism. They often show impaired comprehension relative to expression, so they can say more than they can understand sometimes. This is because there is so much difficulty understanding the social aspects of language, but it has important implications, and it suggests that expressive or productive language strengths can be capitalized on. We can recruit these to improve communication, as in the teaching of appropriate verbal output. More about that a little later. And expressive language deficits also occur in ASD, so that is true, and this happens particularly in the area of initiation. So although conversational initiation is clearly deficient, not all aspects of initiation are. So, for example, a child who hits someone else or leaves an activity to indicate that he or she wants to be finished with it is clearly initiating, even though the behavior is undesirable. The point here is that effective strategies for communication to reduce challenging behaviors must provide a way for the individual to initiate a communicative exchange. The pragmatic deficits of autism are also rooted in deficits in joint attention, which is simply the ability to share attention. There's also theory of mind, which describes our ability to understand and make inferences about the inner mental worlds of other people. And I've tried to show this here, both of these aspects in this image. So typically developing children engage in episodes of joint attention where they share attention to an object. And when they're doing this, they're also monitoring their interactional partner's affect and their engagement. They develop a theory of mind so as to understand other people's mental states, their attitudes, and their thoughts and feelings more generally. So what does all this mean? Well, as discussed more fully a little later on, it means that they are missing out on a lot of the social learning that typical children acquire early and effortlessly. And there are two main implications. One is that we can train joint attention, which is not a primary focus of this task, but it deserves mention. And second, it means that we can use a compensatory strategy by going around joint attention and simply explaining to children who have gaps in their understanding, what happens during social exchanges. And both of these approaches have proven potent for addressing challenging behaviors in autism. So it is important to note also that communication deficits are related to more general challenges in the ability to process transient stimuli and to shift attention and to filter irrelevant information. And accordingly, many popular intervention strategies to support communication and behavior make use of visual supports. This is to capitalize on this area of strength for persons with autism. Visual supports have been used in a range of contexts to facilitate a variety of communicative interactions. They can be used to build vocabulary and help the individual organize his or her thinking. So visual supports have the potential to lessen cognitive load, to make tasks easier, to enhance understanding, and research has clearly demonstrated reductions in challenging behaviors when visual elements are incorporated into treatment plans. Okay, so several strategies for using communication to remediate the core deficits of autism have been developed. We're going to talk about functional communication training, the picture exchange system, and briefly touch on a broader class of AAC strategies, which is augmentative alternative communication strategies, and then a class of interventions known as interpretive strategies. And these approaches are going to differ in their procedures and in their theoretical focus, and sometimes in the target population, that is, for whom these approaches are going to be most appropriate. And although not all of them were developed specifically for the purpose of addressing challenging behaviors, all of them have received an impressive degree of empirical support for this purpose and are evidence-based. And with that, I'm going to pass this over to Hope.
Okay, so what we're going to focus on now is functional communication training. And at its most basic level, communication is an active effort to affect your environment. And communication is so powerful in so many ways, but in a very basic way, it's the power to make changes in your environment. And Carr and Durand were the first to really document this kind of predictable, strong relationship between challenging behaviors and what was going on in the environment. So, for instance, they showed that so when an adult is not providing as much attention, say to a child, and a child is participating in a task that may be very difficult for them, the result is kind of what you'd expect. You get a lot of behavior, and usually unwanted behavior, which makes sense. So if you have a challenging situation, you may have more challenging behaviors. They also show that if you simply kind of teach children to ask for adult assistance or help, problem behaviors decreased. So they noted that even though unwanted or behaviors and asking for help were equally effective at getting adult attention, children overwhelmingly would choose the more desirable behavior, which would be asking for help or assistance, when they had that tool in their repertoire. So the basic idea here is to replace challenging behavior with communicative behavior that really serves the same function. So, for example, if you have a child who's in a difficult situation where there's not a lot of adult support and the task that they're asked to do is quite difficult for them, you want to identify the challenging behavior. So maybe that's hitting. And then you may want to replace it with a more appropriate behavior, which would be something like allowing them a way to say, will you help me, or I'm frustrated, or this is hard. So this behavior is reinforced until it is firmly established so that the child is actually able to really utilize the more appropriate behavior. But there's one thing that we notice. We have to think back to some of those comprehension deficits that we talked about earlier, and there may be more of a relative strength in expressive language. So here the child's expressive language skills are being recruited or used, their strengths, and the child is trained to really initiate communication using some specific phrases. This may also include the use of signs or some form of alternative and augmentative communication system. And these are going to be replacing the problem behavior that serves the same function. So now, of course, we need to make sure we understand the function of the behavior. So this is where what's called a functional behavioral analysis, or an FBA, comes in, and it's really central to functional communication training. Okay. So to understand the functions of behavior and behind a challenging behavior specifically, researchers and providers often conduct a functional behavioral analysis, or an FBA. Some professions, like behavior analysts, it's a lot of what they do. But some research also shows that with pretty minimal training, parents can also conduct an appropriate and effective functional behavior analysis. Although there's a variety of functions that have been identified in the literature, these are typically collapsed into one of 4 primary functions of behavior. So the first one would be attention. So really the goal is to get attention from others. So the reason behind the behavior may be to gain attention. The second may be to objects and activities. So it may be to gain access to a desired object, something that they want, or an activity that they would like to participate in. The next would be to escape or avoid. So really the goal here is to avoid or escape an activity or something that they consider aversive. And then the last one is automatic reinforcement. And this is a behavior that can occur just because it feels good, or maybe it alleviates pain, or has some kind of internal reinforcement. So you really can't talk about functional communication training without discussing a functional behavior analysis. It's really the cornerstone, and it is the first step. So you need to know why a child is engaging in the challenging behavior and really what purpose it demonstrates. Okay. So there are nearly 200 studies, including a number of reviews with evidence to support positive outcomes for individuals with autism spectrum disorder and intellectual disability and related disorders when using functional communication training to address challenging behaviors. The functional communication training meets the criteria for being considered a well-established treatment across a range of challenging behaviors. FCT is designed for anyone who displays a challenging behavior. Individuals who may be nonverbal or those with limited language are taught to communicate using some form of augmentative and alternative communication strategy. Now, it's important to note that there are some potential unwanted effects, however, when we're using functional communication training. And namely, one of these is kind of the overuse of the newly trained response that you've been working on, or maybe even a return to the unwanted behavior is possible if reinforcement isn't delayed, if reinforcement doesn't come quick enough, or it may be insufficient to meet the original need for the behavior in the first place. So now we're going to move into talking a little bit about PECS, which is the Picture Exchange Communication System. And PECS really capitalizes on all of the visual strengths that we see in ASD that we talked about earlier. So for many people with autism, it may sound strange, but it's better to get the language out of the way of the communication because language is often very difficult. And it's transient. So meaning it's kind of here 1 second and it's gone the next. So it's complex, it's sequential, and all of these things can make language difficult to deal with for individuals with ASD. So PECS is really an aided picture icon-based augmentative system that's designed to teach communicative initiations for a variety of functions of communication. This could include requesting an object, it could be answering a question, it could be commenting. By contrast, the more general class of AAC strategies can be considered for anyone with ASD to really support expression and comprehension. So, of course, given the tremendous individual differences in individuals with ASD, the alternative and augmentative communication intervention should always be tailored to the individual's communicative needs. So the first step in PECS is really to teach the child to exchange a picture for a desired object. So if the child wanted the bubble blower, for example, he or she has to pick up the picture and hand it to the adult, and then he or she gets the bubble blower. But we don't just use communication to request objects. And so this is later expanded upon in picture exchange for the purposes of being able to ask questions and also to make comments. So unlike the broader class of augmentative and alternative communication strategies, which can be used across the spectrum depending on the specific strategy that you choose to use, PECS was really designed for those with more limited or no functional communication. So research investigating PECS really demonstrates the effectiveness in supporting the communication of children with ASD who have limited or no functional communication. Much of the efficacy research for PECS reports very positive outcomes for increasing verbalizations, as well as increasing social initiations, as well as decreasing some of those problem behaviors that we've discussed earlier. But not all results are consistently observed for all participants in studies, and so this really highlights the importance of recognizing and addressing these individual variations and differences in needs. Okay, now I'm going to pass this back over to Tiffany.
Okay, so I'm going to be talking to you about a broader class of strategies known as interpretive strategies. It's one of my favorite topics. It's been the focus of much of our research at the University of Vermont, and so I love talking about interpretive strategies. So people of course, communicate because they want to request objects or because they want to affect their environment, as Hope was talking about. But people also communicate, and I would say primarily communicate, for the purposes of joint attention. That is to bring another person's focus of attention in alignment with one's own for the purpose of sharing an experience. And as noted previously, a deficit in communicating for joint attention is a hallmark impairment of autism, and this is going to restrict access to social learning and social information and cultural learning more broadly. But it's not as if persons with autism do not acquire any social or cultural knowledge, right? They absolutely do, but there are misunderstandings or gaps in understanding or not fully developed understandings. And as you might imagine, this can lead to a great deal of anxiety. So one model of the disorder supposes that it is these misperceptions or incomplete understandings of social events that leads to anxiety, which in turn may manifest as aggressive or oppositional behavior. We're talking about tantrums, rages, and meltdowns. And so the intervention model that follows for interpretive strategies is that they lead to increased social understanding and decreased anxiety, which in turn is believed to promote more appropriate behaviors and reduce challenging behaviors. Now, interpretive strategies are adult-mediated activities, and they make use of visual supports. These could take the form of photos, drawings, or worksheets to structure a conversation. They can be employed after an unsuccessful behavior, I think in practice they usually are, or prior to an anticipated challenging situation. We know that going to the gym is always difficult, so we can have an intervention right before that event using a priming strategy to help the child be more successful. But they don't have to be associated with unsuccessful situations and problematic behaviors. I think this is an important point. They can also be used to celebrate successes. Sometimes it's just as important to catch the child doing something right and to give meaning to the event through praise. And this is important for motivation also. You probably wouldn't want to engage in this kind of intervention with me if it meant that every time we sat down to do it, we had to discuss something that you did wrong or something that was hard for you. Well, neither does the child. And so affirmative conversations are also important and they are encouraged. So the purpose of interpretive strategies is to help the individual with autism to understand social situations and develop problem-solving skills by reviewing behavioral and social issues using a structured visual format. There are a variety of interpretive strategies that have been developed, and they vary in the nature and the degree of structure that they provide. And also they differ in the extent to which they invite or require active participation. So the first two of these that are going to show up on the left-hand side of your screen, social skills autopsies and the SOCCSS strategy. These are informal strategies, meaning that they have not been manualized. They use a simple worksheet where the child and the adult analyze a situation in terms of what happened and what went wrong and how can I fix it next time. And these two are not usually done in an affirmative way. They are in response to a difficult situation. These are commonly used in schools, and they're quite popular, so I include them here. And if anybody wants to see what these look like, I have slides that I can show you. But for now, I'm not going to spend a lot of my time on these because their efficacy has not been formally evaluated, even though they are well-liked and they're used by many school professionals. For now, I really want to turn your attention to two of the most popular interpretive strategies, and these are a class of what's called story-based interventions, and the two most popular and well-researched of these are social stories, which most people are familiar with, and comic strip conversations. Both of these are developed by Carol Gray. So let's zoom in on social stories. Social stories are personalized stories. They're constructed in order to give the individual direct access to social information. And again, the idea here is that advances in social understanding should be accompanied by more appropriate behaviors. So again, story-based interventions need not focus only on problem behaviors, and affirmative stories that celebrate success and offer praise are encouraged. And although these are one of the most popular interventions used in autism, recent research estimates that that about 40% of school professionals, and here we are usually talking about SLPs, use them regularly. And my experience suggests that all SLPs working in the schools, they know what these are. But in my experience, these are often also not developed appropriately, and this is unfortunate. And if you have questions about what the common problems are, I'd be happy to entertain those questions later on. But in a nutshell here, I'll just say these need to be, one, personalized. Two, they need to give accurate social information. Three, they need to adopt a patient and positive tone. These are not punishments, these are supports. And finally, the story must explain the who, what, when, where, how, and why surrounding a challenging situation. So here is an example of a social story, and although, like I said, I suspect most of you are familiar with these, I thought an example was needed to tell you, to really show you what it looks like in case you weren't. So here is a social story that we wrote for a kiddo who was having trouble with his morning routine, specifically getting dressed in the morning. So we collaborated with parents. We did a lot of homework around trying to understand the precise nature of the problem and how he experienced it, right, from his perspective. So this is personalized. These stories are vetted with families then to make sure that we get it right and that the language used is appropriate and will be understood by the child. We also try to keep these fairly short, and we've gone to great pains also to make sure that these are literally accurate. And you'll see the visual supports incorporated here also. So getting dressed in the morning. My name is Evan. Every day when I wake up, I need to get dressed. Usually, before I go to bed, my mom or my dad helps me pick out my clothes for the next day. When I wake up the next morning, I have the clothes I need to get dressed. If we forget to pick out the clothes the night before, my mom or dad can help me pick out the clothes that I need. Sometimes I don't want to get dressed in the morning. When I don't want to get dressed, I get angry. Sometimes I pinch, hit, kick, scratch, or throw things at my mom and dad. This makes my mom and dad sad because they're trying to help me get ready for the day. It makes my mom and dad happy when I get dressed without pinching, hitting, kicking, scratching, or throwing things. Sometimes when I get dressed without getting angry, I might have time to do something that I like. I will try to remember to get dressed without getting angry. So there's an example of social stories, and I'll talk more about their efficacy after I describe kind of a sister intervention known as comic strip conversations. And I like to talk about these two together because they have a lot in common. The theory underlying them is the same. But here, instead of delivering a story or reading a story that the child, we hope, will listen to and understand, which is a pretty passive exercise, you sit down with the child and you actually have a conversation with the child, and you draw as you talk. So you usually use I have an example here, what's called a symbols dictionary. So before you engage in conversation, you'd use something like this, and you'd say, here is what we're going to do. We're going to draw while we talk, and here's how we draw people, right? Simple stick figures. And here's how we draw what people say using a talking bubble. And here's how we draw what people are thinking. We're going to use a thinking bubble, and here's how we draw listening, here's how we draw interrupting, and so on and so forth. So here's one example of a very basic symbols dictionary, but it gives both of the participants kind of a common vocabulary, if you will, and a set of conventions for engaging in a conversation. So what you do is you discuss an event in terms of, again, the who, what, when, where, and why, and you work through it with the child. You recreate the event. You talk about who was present, what happened first, second, third, how did that make people think and feel, and you draw it out so that the child has those visual supports. Then you say, well, let's brainstorm some solutions, right? And you write these down and you talk through them. You decide which ones are the most viable. You decide which one of these am I going to try first next time? What am I going to try second? You actually number them, 1 and 2. Anything that's not a viable solution ends up getting scratched out. And again, those visual supports are important. Having the opportunity to talk about a set of solutions, but then, crossing one out so that the child can see and use that visual support is important. Here's an example of a comic strip conversation that a mom had done with her young daughter, just so you get a sense of what it looks like. They're pretty crude drawings, and that's okay. What's really important is that there's a spirit of non-judgment. You're asking a child to really work through, think about, and talk about, share a really difficult event. So making sure that this is non-judgmental is important. Because it's easy when the child says, well, what happened next? He'll say, well, I hit the teacher. And at that point, you might say, well, you don't want to do that, right? But you resist and you say, okay, all right, let's draw that down. Let's talk about that. You hit the teacher. Okay. And how did that make her feel? Right? And what happened next after that? So it's really to get the child to process through this situation. So again, they're very much like social stories. They're both personalized. They both take advantage of the visual strengths in ASD. They are positive behavior interventions. They address a wide variety of communicative and behavioral challenges. But whereas social stories are a pretty passive exercise, as I said before, in the comic strip conversation, the child is recruited as an active participant. So the child is encouraged to the fullest extent possible, assume responsibility for the majority of the drawing and the writing and the conversing. Now, the degree to which this is possible varies greatly, as you might imagine. So sometimes the adult assumes most of the responsibility for these things, but our research has actually shown, and this might be surprising to you, that this intervention, social stories and comic strip conversations, can actually be used with those with the most limited language effectively for remediating or reducing challenging behaviors. It just might look a little different in terms of the degree of responsibility that the adult is taking. Okay. So social stories and comic strip conversations have been evaluated as a broader class of strategies known as story-based interventions. Social stories have been examined far more than comic strip conversations, but as a group taken together, they have been rigorously evaluated. And story-based interventions have been identified as one of 11 established treatments in autism by the National Standards Project. They have also been found to be effective for addressing a wide range of problem behaviors in school and home settings, and I really do mean wide. So research includes reports of positive effects to address, disruptive behaviors, tantrums, to reduce aggression, to reduce self-injurious acts, to even reduce stereotypy. It has been shown to increase more appropriate behavioral routines, and this could be around, getting dressed in the morning or toileting. So there are a wide variety of topics that have been demonstrated effective in this research base. It should also be noted that there's tremendous variability in effect size, and by that I mean how effective the interventions are. So this is true within and across studies, and it's been observed that there are certain participant characteristics that predict success, although this is not related necessarily to verbal or cognitive skills. And research has also shown, as I talked about, as I previewed just a minute ago, that these have been documented to be effective for children who are nonverbal and children with the most severe cognitive deficits. Okay. So although originally intended for individuals with high-functioning ASD, that is true, more recent evidence is going to confirm their use for populations with more challenges. Now, I had originally hoped to show you an example of a comic strip conversation in action, but that's not going to be possible. But I would like to share with you a story, and this is based on some of our research, and this is published. I'll just share a case with you about a child we're going to call Zach. That's a pseudonym. And we went to Zach. We met Zach when he was 5, and he had just been diagnosed with autism, classic autism. And he had some characteristic, not surprising kinds of challenges that we come across, and really difficult for him was transitioning. Let's say he would have a lot of challenging behaviors around when he was required to shift attention, so transitioning, going from one activity to another was very difficult for him. But he also had this in the context of a violated expectation or something that was surprising. So, fire alarms were really hard for him, or, he would need to know where he was going to go on errands with his mom. So his mom would do a picture schedule, and she'd say, okay, first we're going to go to the post office, then I'm going to drop by your school and pick something up. Then we're going to go out to lunch, and then we're going to come home. But if she would forget, something in there and realize, partway through their day that she was running out of gas and she needed to stop at the gas station, that wasn't something that he had planned for. It wasn't something that he expected, and he would have lots of meltdowns around that. So unexpected events, violated expectations, transitioning, just problems with flexibility more generally, really, really difficult for him. And so this was had a negative impact on the family's life, and they would report to us, we're really scared to take him anywhere. We don't know, when something like this is going to happen, and it's difficult for us to prepare for that. So we decided that we were going to target this in an intensive intervention where we saw him for 6 weeks, 3 times a week, where we would come in specifically to talk about these kinds of situations. So a mom would keep records and tell us about what happened. We would show up with him, and we would have a structured conversation about that using a comic strip conversation. So here is some data. We also had mom track data for us. So these are reports from the mother's rating of the child's behavior on a daily basis. So you'll see a baseline phase. Lower values reflect more problematic behaviors. Higher values reflect improvements in the child's behavior. And we asked her about 2 things. We really wanted him to be able to, one, calm down. So we wanted him to be able to stay calm in this situation, but we also thought it was important that he be able to use his words to talk about the situation. And you'll see that these 2 lines parallel each other, and these proved to be really, really powerful for Zach. And there's other data that the mother provided that suggests that this generalized across a range of settings, and that makes sense because we didn't just talk to him about one challenging situation again and again and again. We talked about a variety of challenging situations involving transitioning that happened over the course of several weeks, so we used lots of different examples. So one example would be they went out to Chili's one day, and he ordered some apple juice. He expected it to come in a kid's cup. So that would be a plastic cup, and they usually have a lid on them with a straw coming out the top. But this restaurant on this day was actually out of lids. So they brought him apple juice, and they put it in a cup with no lid, a kid's cup. This really put him over the edge. He lunged at the waitress. He tried to scratch her and hit her, and he said, "You're bad. I don't like this place." And so we would have a conversation with him about that week, and we'd say, what happened? How did people feel? What were people thinking? What could you do next time to be more successful? And so Mom noticed some real changes in him over the course of the intervention, and she would say, he's changed in his approach. He still has a very strong reaction when there's a transitioning event. So these are still difficult for him, but he is able to handle it. It is much more manageable. And now, instead of lunging and hitting and scratching, what he does is he is able to keep his body still. He's able to be calm, and he's able to talk about the situation. So he's still very upset. He would cry, but he would come to Mom and say, "I'm having a hard time. I need to talk about this," which is exactly what we were looking for. And this was really important and positive going forward also, because the more dialogue he was able to have around these tough things, the more opportunity there was, to share and to talk about the difficult event and what happened. So we are encouraged by these and other data for interpretive strategies. And so the conclusions, because I need to bring this to a close, I want to respect everybody's time out there, is that in a vital sense, there is no distinction between communication and behavior. If you think about it, right? The act of communication itself is behavioral. And all observed behaviors, whether or not they are intended as communicative, have message value. And herein lies a major challenge and a source of anxiety for individuals with autism who may lack recognition not only of this relationship between communication and behavior, but of the power of communication for sharing meaning and for social understanding and for satisfying needs more generally. And so this talk considered several strategies for using communication to address challenging behaviors in autism. Each approach targeted one or more of the communication impairments characteristic of autism, which contribute to deficits in the pragmatic domain, as we explained earlier. Now, whichever strategy is employed, I believe it is imperative that a genuine attitude of respect for the individual and his or her perspective needs to be adopted. There are misunderstandings between people, and what we call challenging behaviors can make perfect sense when viewed by the person with autism. So in short, an attitude of respect and not judgment helps move us toward understanding the reasons behind maladaptive behaviors so that we can address them most effectively and with the most careful consideration. I should just take a second to again underscore the importance of communication initiation. All of the reviewed approaches are designed to support communication initiation. This is critically important because initiation provides a means for affecting one's environment, sharing attention, and satisfying needs. I also think that the communication system should be effective at reducing challenging behaviors from the moment that it is introduced. And this is true even if the ultimate goal is to progress to a more sophisticated symbolic system. So this does not mean that a focus on processes like foundational processes like joint attention cannot be emphasized, and to the contrary, it's absolutely true that joint attention training can be beneficial for all individuals with autism and may be particularly important for those with the most limited language. But it does mean that creating opportunities for joint attention is likely to be a more challenging and less immediately rewarding task for the interventionist and also for the family. But nevertheless, such an approach will focus on addressing the child's fundamental rather than a more outwardly the observable, aspects of a language impairment. And with that, I'm going to conclude the discussion, but I have something I'm supposed to read. Oh, and some questions. Do I need to read that? No. Okay. Okay, so there are some questions here. Oh, okay. So one of the questions was, can I give an example of how a social story can be used inappropriately? Sure. One thing is that I notice in practice when I'm working with speech-language pathologists in the school is that they do not always adopt a patient and positive tone. Like I said, these are not punishments. These are non-judgmental. And so that is one problem that I come across quite a bit. I often notice also that they are much too long. And we need to make sure that the language that's used, right? So how long the story is, how complex the sentences are, the nature of the words that we choose. We agonize. In our research, we really agonize over these choices. They are not made casually because we need to make sure that the language is understood by the child. Another way that we do this is we do formal assessments of language, but we also, like I said earlier, we vet these with the families to make sure that they think, number one, it's relevant to the family priorities, but number two, that they're going to be understood by the child. And another thing that I notice is they often are not personalized, and this can be confusing sometimes. I know that there are books out there that are, they're standard, ready to use social stories. Gray herself has put out several books where you are presumably able to, take a story about standing in line at school. Standing in line at school is a really difficult thing for a lot of kids with autism. I can't tell you how many stories we've written about standing in line at school. But a generic story, it may not hurt, but I don't think it's going to get you where you need to be. And even Carol Gray is going to say these need to be personalized. Because if you think about it, there's lots of different reasons, and this goes back to what Hope was saying. We need to understand the reasons behind the problematic behaviors. If there's a kid who's having a meltdown when he's in line at school, we need to know why that is. Some children are going to be very anxious because they don't know where they're going. They need to know what's the next plan. I had one little boy who said, I get really nervous because we're walking down a hall and I'm not sure where we're going. He really needed to be at the front of the line. In that situation, a small environmental adjustment can make all the difference in the world. Another child is going to tell you, I get really upset when I'm in line because other people aren't following the rules, and I am. I know that when I'm in line, I have to keep my hands to myself and I'm not supposed to talk. But other kids are talking and they're touching each other, people. And, we have so many kids on the autism spectrum who are all about social justice, right? And the rules, and they really want to adhere. And when other people aren't doing it, that can make them very nervous and, and lead to all kinds of So what the problem is really does matter, and it requires a good deal of homework. You need to go in, you need to observe, you need to get good information from people who are close to and who understand the challenging situation. And I can go on and on. There's a few there. So I'll stop there. There's another question here. It says, when you are working with children to talk about situations, do you have any suggestions on how to ask the child for what he or she is feeling? This is an excellent question. And I could have said, probably should have said earlier, that if you think about social stories and comic strip conversations, one is a passive exercise, as I said, where we create a story for the individual. The other one is much more dynamic. Comic strip conversations, you are probing understanding, you are asking questions, and it's so true that oftentimes we don't understand the reason behind a behavior. So you can do things like a functional behavior analysis, but you can also just probe the child to find out, and you'll be surprised. I'm often so surprised at what I found and what the thinking or what the problem was behind a behavior, and we often do that using comic strip conversations. And for this reason, Carol Gray herself has recommended that comic strip conversations be used as a precursor strategy before you develop social stories, precisely for this reason, that they are so good at unearthing, right, the who, what, when, where, and how, and why of the situation, because these things aren't done just to explain to the child, what other people are thinking and feeling. Children with autism have emotions, but they often have difficulty understanding their own emotions. So it's, explaining to the child, when I get up in the morning and they want me to get dressed, that makes me upset. And it makes me feel this way, and I might get anxious or I might get frustrated. So we do that through comic strip conversations. It's an excellent question. If you might be thinking, what can I do if the child is nonverbal? Usually in that situation we pair it with a visual support that shows all different kinds of emotions, and you can ask the child questions and ask them to point, because remember, just because a child is functionally nonverbal does not mean that they have a low receptive vocabulary, and often their receptive vocabularies are quite good. They can understand what you're asking and they can communicate through pointing. So there's the way to get at it from a non-verbal standpoint. Okay. What does it say? Oh, good question. Okay, so the question is there any evidence for social stories being used in adolescents and young adults? There are precisely two studies, that have been conducted on adolescents. There are 0 studies that have been conducted on social stories. So even though the theoretical, the idea underlying social stories should hold for any population regardless of age, we haven't seen its efficacy documented in older populations. My suspicion is that doesn't matter, and that they would be effective, and that the most important consideration in that respect is thinking about what kinds of adjustments would be appropriate for people who are older. And Carol Gray has talked about moving away from social stories that might seem more appropriate for a juvenile to changing the structure of it. So you might have something that looks more like a newspaper article, for example, with less pictures or smaller pictures. And so maybe she's concerned about removing any babyish type content for adults, but it's a great question. It has not been empirically studied. It's on my to-do list. So many research questions, so little time. Okay. We're looking back here through the questions. That's a good question. You want to take it? I'm going to pass this over to Hope. There's a question that I think she's going to be better at answering than I am.
Okay, so the question was, do you have any suggestions on the use of rewards and reinforcements? It says, when I use these with my daughter, I find she wants more of whatever we're giving her. And that lets you know right there that clearly it's a strong reinforcer, so that's a good thing. But the important thing about reinforcement is it may start in a situation where you have a behavior that you're really just first starting to address and using reinforcement to get that positive behavior. And that means you may be giving that reinforcer every time you see that behavior. And therefore, it's more likely that you're going to see that behavior more frequently, that positive behavior that you're looking for. However, the important thing to do is as you start seeing more of that positive behavior and less of the undesirable behavior, is that you start kind of ratcheting back how frequently you're providing that reinforcement and that reinforcer. Because we want to see the child be able to demonstrate that positive behavior maybe 4 or 5 times before they get reinforcement. And so sometimes this is done through what's called token reinforcement. So we may use a visual system to let them know that they're earning tokens for all the positive behaviors that they're demonstrating. And once they achieve what the identified amount of tokens are, 5, 10, whatever it is, they will receive reinforcement. So that's one way to kind of work with reinforcers and rewards so that you're starting to get more of that desirable behavior before you provide the reinforcement. Okay, so we just want to thank you for joining us for today's webinar. This webinar will be archived on Vermont Family Network's website, along with more than 30 previously recorded webinars. So please visit www.vermontfamilynetwork.org and have a great day.